Welcome to the Dr. UUT lectures. Topic is diabetes mellitus. Remember that we have two types of the diabetes mellitus, type 1, type 2. And in today's topic, we'll be discussing type 1 in a little bit detail. Like how? Very simple. Type 1 is further composed of type 1A and type 1B. Got? Very simple. Now, what is the difference between type 1A and type 1B? Very simple again. Now, what is that simple thing? If pancreatic islets B cells, means beta cells, are destroyed because of autoimmune process. What? If pancreatic islets beta cells are destroyed because of autoimmune process, then that particular patient becomes type 1A diabetic. What? Type 1A diabetic. And what? If pancreatic islets beta cells are destroyed because of some other means there is no involvement of the autoimmune process. If autoimmune is not involved and some other means are involved, some other genetical factors are actually causing the destruction of the beta cells, so then in that case that patient is actually idiopathic, or you can say type 1B diabetic. Type 1B diabetic. And another important point is that majority of the diagnosis, when diagnosis is done, so majority cases are actually type 1A diabetics, means 95% cases are of type 1A, and the remaining 5% are actually called as type 1B or idiopathic diabetes mellitus. Once again, in short, we have two types of the diabetes, type 1 and type 2, and in the type 1 we have subtypes, type 1A and type 1B. If pancreatic cells are destroyed because of autoimmune process, we call that particular type as type 1A. And if the pancreatic cells are destroyed by some other means there is no involvement of the autoimmune process, there is actually the involvement of the some other genetical factors, so in that case that particular patient is idiopathic, and the type is known as idiopathic type 1 diabetes or type 1B type 1 diabetes. Okay, I hope you got. If still you have confusion, drop that in the comment box. Thank you for watching Dr. UGT lectures.